nutritional assessment, and vitamins. So lab analysis for vitamins. So the assessment of vitamin status is and function in the body can be performed through the various biochemical and metabolic measurements. So we can do a measurement of active cofactors or precursors in serum or cells. This involves directly measuring the levels of the biologically active forms of vitamins or their precursors within blood serum or specified cells or specific cells. So for example, measuring active vitamin B12 or folate levels in serum, and this is to assess nutritional status. You can also do measurement of urinary metabolites. So some vitamins are metabolized into specific compounds that are then excreted into the urine. Measuring these metabolites help estimate vitamin intake or status indirectly. So an example of this would be urinary methylmalonic acid. These levels increase when vitamin B12 is deficient. We can also measure the biochemical function. This evaluates the activity of vitamin-dependent enzymes or biochemical pathways to infer vitamin sufficiency. Example would be erythrocyte transcatolase activity for assessing thiamine or vitamin B1 status. We can also do measurement of urinary excretion of vitamin or metabolite after a test load. So after administering a controlled dose of vitamin, which would be the test load, the amount excreted in urine is measured. This assesses absorption, metabolism, and retention capacity. Example would be administering a vitamin B2 load and then measuring riboflavin excretion. We can also do measurement of urinary metabolites of a substance which requires the vitamin. So some vitamins are essential cofactors for metabolizing specific substances. Measuring the metabolites of these substances can indirectly assess vitamin function. So for an example, measuring urinary forma-immunoglutamic acid accumulation in folate deficiency. We'll go ahead and talk about some vitamins. So vitamin A exists mainly as retinol in retinoic acid, and it is essential for several critical biological functions. It is necessary for dim light vision or night vision because it is a component of the rhodopsin, which is a pigment in the retina that detects low light levels. Beyond vision, vitamin A is also crucial for cellular differentiation, which helps cells mature into their specific types. Growth and development also helps with reproduction and immune system function as well. Vitamin A deficiency is mainly found in non-industrialized countries where it remains a major cause of preventable childhood blindness and increases susceptibility to infections. Clinical note on this is you have Accutane, which is a synthetic isomer of vitamin A, and that's used to treat severe acne. It is a tetragenic and can cause serious congenital defects if taken during pregnancy. Therefore, laboratory tests such as triglyceride levels and pregnancy tests are required before starting treatment and monthly during therapy to monitor safety. Vitamin E, its function acts as a powerful antioxidant. It helps to protect unsaturated lipids from peroxidation, which is damage caused by free radicals. It helps to maintain cell membrane integrity by preventing oxidative damage. Vitamin E deficiency can lead to hemolytic anemia due to increased oxidative damage to red blood cells. The red blood cells become fragile and then they become prone to rupture. Clinical use, this is supplemented in premature newborns to help stabilize their red blood cells and prevent hemolytic anemia that can be associated with oxidative stress. Vitamin D is a fat-soluble vitamin crucial for maintaining calcium and phosphorus balance, and that's essential for healthy bone formation and really just overall mineral homeostasis in the body. Functions of vitamin D, it helps with the bone formation and mineral homeostasis. So vitamin D promotes the proper development of the skeleton. It maintains calcium and phosphorus levels, as mentioned earlier, in the blood, and that helps to ensure that the minerals are available for bone growth and repair. Also helps with regulation of calcium and phosphorus. So the active form of vitamin D increases intestinal absorption of calcium and phosphorus. The minerals are vital for strong bones and teeth. Other roles, it supports the immune function, and it also plays a role in muscle function and cardiovascular health. So vitamin D exists in two main forms in the diet and skin, so vitamin D2 and vitamin D3. Vitamin D3 is produced in the skin when it's exposed to the UV rays from sunlight. So conversion to the active form of vitamin D from skin or the diet is transported to the liver, where it is hydroxylated to form 25-hydroxyvitamin D, which is the main circulating form and indicator of vitamin D status. In the kidneys, vitamin D25 undergoes further hydroxylation to form the biologically active metabolite 1,25-dihydroxyvitamin D. Mouthful. 1,25 dihydroxyvitamin D binds to vitamin D receptors in the intestines, bones, kidneys, and other tissues. In the tissues, it increases expression of calcium binding proteins. It also enhances absorption of calcium and phosphorus from the diet. In the bone, it regulates mineralization by influencing osteoblast and osteoclast activity. And then in the kidneys, it helps regulate calcium reabsorption. So some clinical significance, if we have vitamin D deficiency in children, it can cause rickets, which is actually characterized by soft, weak bones. They can have skeletal deformities such as bowed legs or knocked knees, and a delayed growth and development. In adults, vitamin D deficiency can lead to osteomalacia, where bones become soft and prone to fractures. It can contribute to osteoporosis and increased bone fragility due to impaired mineralization and bone loss. So some symptoms of vitamin D deficiency is bone pain and tenderness, muscle weakness, and increased risk of fractures. So to diagnose this, when evaluating bone disorders or suspected hyperparathyroidism, it is important to measure the serum calcium levels, and that will help to assess the calcium status. And also a parathyroid hormone level. It will be elevated in hyperparathyroidism, which can influence vitamin D metabolism. We'll also do a serum vitamin D25 to determine the overall vitamin D status. And then we'll also do the 1,25 vitamin D, which is the active form. It can be useful in certain conditions like hyperparathyroidism or even kidney disease. So vitamin D in hyperparathyroidism. So excess PTH increases the conversion of the 25 vitamin D to the 1,25 vitamin D. This leads to elevated calcium absorption and increased serum calcium levels. So measuring the PTH, calcium, and 1,25 vitamin D can help differentiate causes of hypercalcemia. Vitamin K, the term coagulation, comes from the German word coagulation or blood clotting. Vitamin K is a fat-soluble vitamin. It's essential for the blood coagulation process. Functions of vitamin K, it's essential for the formation of the coagulation factors. It's required for the synthesis of prothrombin, which is factor 2, and clotting factors 7, 9, and 10. Also necessary for the production of anticoagulant proteins like protein C and protein S. They help regulate blood clotting and prevent excessive coagulation. So vitamin K is primarily synthesized by intestinal bacteria or your gut microbiota. It can also be obtained from dietary sources such as leafy green vegetables like spinach and kale, and even some plant oils. Vitamin K acts as a coenzyme for the enzyme gamma-glutamyl carboxylase, which modifies glutamic acid residues on clotting factors. This modification enables these proteins to bind calcium ions, which is essential for their biological activity in the clotting cascade. So if we have a vitamin K deficiency, it's rare, but it can occur due to if people are taking antibiotics, because that can disrupt your gut bacteria. Can also occur due to malabsorption syndromes and also liver disease in newborns because they kind of have sterile intestines at birth, so they have low vitamin K to begin with. Deficiencies can lead to increased risk of hemorrhagic episodes or bleeding disorders due to impaired clotting factor synthesis. So laboratory findings on our side, we will see, if you've gotten to hematology yet, you'll see a prothrombin time, and that's going to be prolonged in vitamin K deficiency, and that's because factors 2, 7, 9, and 10 are vitamin K dependent factors. The PT is also prolonged in liver disease because the liver produces those clotting factors as well. Vitamin K antagonist, so Coumadin is a vitamin K antagonist, and that's used for anticoagulant therapy. What it does is it inhibits vitamin K recycling. Therefore, it reduces the synthesis of functional clotting factors and prevents thrombosis. All right, thiamine, or vitamin B1, its function is to act as a coenzyme in energy metabolism. It is specifically involved in the metabolism of carbohydrates by assisting enzymes in the Krebs cycle and pentose phosphate pathway. It is essential for the conversion of pyruvate to acetyl-CoA and the production of ATP. If we have a deficiency in vitamin B1, a chronic deficiency can cause beriberi, which presents in two forms. So you have dry and wet. The dry is where there's peripheral neuropathy, muscle weakness, and paralysis. And wet is cardiovascular symptoms, can include edema, heart failure, and tachycardia. In the United States, this is most commonly seen in chronic alcoholics. This is due to their poor dietary intake usually and impaired absorption and metabolism. Riboflavin, or vitamin B2, it functions as a component of two important coenzymes, so the flavin mononucleotide and the flavin adenine dinucleotide. These coenzymes are involved in the oxidation reduction reactions in the body. They play a critical role in energy production via the electron transport chain. They help in the metabolism of fat, drugs, and steroids, and also cellular respiration and mitochondrial function. If there is a deficiency in vitamin B2, it can occur due to, once again, alcoholism, which impairs absorption and can increase nutrient requirements. Can also occur in starvation or malnutrition, which can, because there's an insufficient intake. Riboflavin deficiency will often, or vitamin B2 deficiency, will often present with cheilitis, which is cracking at the corners of the mouth, glossitis, which is an inflamed tongue, seborrheic dermatitis, and eye symptoms like photophobia and blurred vision. All right, vitamin B6. There are three related compounds to this. So we have pyridoxine, pyridoxal, and pyridoxamine. The functions are it acts as a cofactor for numerous enzyme systems, especially the amino acid metabolism. Examples are the AST and ALT. It plays an essential role in maintaining the integrity of the brain and normal neurological function. Also plays a role in the porphyrin synthesis, which is crucial for hemoglobin production. Also supports the immune system and also helps regulate endocrine metabolism. Niacin, or vitamin B3, functions as a component of two vital coenzymes. So bear with me here. We have nicotinamide adenine dinucleotide, or nicotinamide adenine dinucleotide phosphate, NAD and NADP. These coenzymes participate in a large number of oxidation reduction reactions that are essential for cellular energy production, metabolism of carbohydrates, fats, and proteins. They also help with DNA repair and signaling. So if we have a deficiency in this, it can cause pellagra, which is characterized by 3 Ds: diarrhea, dimension, dermatitis. If untreated, pellagra can lead to death. And the deficiency could come from poor diet, once again, alcoholism, or conditions that impair absorption. Folate. In B12. So folate is vitamin B9, but we usually just call it folate. Vitamin B12 is called cobalamin, but we call it vitamin B12. Why we do that, I don't know. We like multiple names. Anyway, both of these will function as a coenzyme in one carbon transfer reaction, which is crucial for DNA synthesis and methylation. Folate and vitamin B12 are closely related metabolically. These are both essential for nucleotide biosynthesis, for proper red blood cell formation, and for neurological function, especially vitamin B12. If we have a deficiency, there can be some hematologic changes. So a deficiency of either folate or vitamin B12 can result in abnormalities in the hematology world. So folate deficiency It can go to megaloblastic anemia. So for laboratory findings, we would see a low serum folate level. We would see hypersegmentation of your neutrophils. So if you haven't taken heme yet, that is neutrophil with 5 or more lobes. Low red blood cell folate as well. We would see macroovalocytes, so large oval-shaped red blood cells on the peripheral smear. We would see megaloblastic changes in the bone marrow, which means there'd be large immature red blood cell precursors, and this can result in anemia due to ineffective erythropoiesis. Physicians will commonly order both serum and red blood cell folate levels to assess the folate status. Serum folate will reflect recent dietary intakes and circulating folate levels. Red blood cell folate will indicate long-term folate storage within the cells and really is a better indicator of folate status over time. Increased folate requirements. So there are times during life where we may need to take supplements for folate because there is a higher demand, and that would be times during pregnancy and lactation. Adequate folate during pregnancy is critical for fetal development. It can significantly reduce the risk of neurotube defects like spina bifida and anencephaly. Consequences of folate deficiency can lead to impaired cell division, especially in rapidly dividing cells like those in the bone marrow. Can also lead to altered protein synthesis due to a disruption in DNA and RNA production, and can also result in megaloblastic anemia and other systemic effects. Let's see here. So folate deficiency, once again, can be found in megaloblastic anemia. So folate deficiency is a primary cause. It's leading to impaired DNA synthesis and abnormal red blood cell formation. Alcoholism, as mentioned before as well, due to poor dietary intake. Alcohol also interferes with folate absorption and metabolism. Malabsorption syndromes like celiac disease, Crohn's disease, or even tropical spur can impair folate absorption in the small intestine. Certain carcinomas can also, so rapidly dividing tumors can increase folate utilization. Chemotherapy can impair folate metabolism. Liver disease can be causing impaired storage and metabolism of folate. Chronic hemodialysis, so loss of water-soluble vitamins, can include folate during the dialysis process. Hemolytic anemia, so you have an increased red blood cell turnover, which will increase your folate requirements. And also sideroblastic anemia, because there's an ineffective erythropoiesis and altered folate metabolism. Back to vitamin B12. Its absorption is mediated by a binding protein called the intrinsic factor, or IF. Most of vitamin B12 absorption occurs in the terminal ileum after binding to intrinsic factor, which is secreted by the parietal cells of the stomach. The vitamin B12 intrinsic factor complex is essential for efficient absorption. If we have a vitamin D or B12 deficiency, it can cause pernicious anemia. That's a classic result of a vitamin B12 deficiency. And that is caused due to lack of the intrinsic factor, and that is due to an autoimmune destruction of the parietal cells. They'll have a presence of antibodies against the intrinsic factor, and that will block the B12 binding or the absorption of it. Deficiency may also arise from defects in the secretion of intrinsic factor, or from the malabsorption syndromes that can affect the terminal ileum, or if there was a surgical removal of parts of the stomach or ileum as well. And then vitamin C, also known as ascorbic acid, it functions in hydrogen transfer and regulation of intracellular oxidation reduction potentials. It's required for normal amino acid metabolism, including metabolism of certain drugs. This is crucial for the formation and stabilization of collagen, which is a structural protein in the connective tissues. And it enhances the absorption of minerals, especially iron. It plays a role in wound healing and maintaining healthy gums and blood vessels. If we have a vitamin C deficiency, you may have heard of it before. It's called scurvy. So clinical features of scurvy Can include hemorrhagic disorders due to weakening blood vessel walls, can also lead to swollen and bleeding gums, can lead to impaired wound healing, and can also lead to anemia due to impaired iron absorption and blood loss.